Hello, everyone. Welcome to Doctors Making a Difference. I'm your host, Dr. Peter Crane. I'm a physician in rural Idaho where I've been in practice since 2011. Over the past couple of years, I've had the opportunity to be both a physician and a patient, and I've been so thankful for the doctors and other healthcare professionals who have helped me. I invite you to join us as we highlight physicians around the world who are making a difference in their communities and with their patients. Our goal is to give physicians and other healthcare professionals the tools they need to be successful in medicine, in finances, and in life. What we do makes a tremendous difference for our patients and our communities. Please go to your podcast service or YouTube channel and give us a 5-star review and hit the like or subscribe button. It helps get the message out to others. You can also check out more content on our website, doctorsmakingadifference.com. Finally, if you would like to be on the show or have any questions or topics that you feel should be addressed on the show, please contact me. The easiest way to get in contact is to subscribe to the newsletter and then hit reply to any of the newsletter emails. Welcome to the Doctors Making a Difference podcast. Today we have my friend Bukhosi Dube who's here, and I really appreciate Bukhosi taking the time to come on. And Bukhosi, do you mind introducing yourself to our audience?
Hey, Peter, it's good to see you again. It's been a very long time. My name is
Yeah.
Bukhosi Dube. I'm a physician by training, an internal medicine doctor, and did primarily hospitalist for most of my adult life. I've transitioned to being the chief medical officer of a federally qualified health center here in Portland, Oregon.
That's awesome. How long have you been in Portland?
Moved here in 2011, July of 2011, shortly after residency in LA.
Oh, that's awesome. Well, so as a background, Bukhosi and I went to medical school together at the University of Utah, and we knew each other during those years. I had a daughter that was born during that time, and I believe you did too. And kind
Yes,
of
I
a
did.
kind
Yes,
of
I did.
a kind of some special memories of that time. And you did residency, and so did I. But where did you end up doing your residency? Just tell the folks on our listening.
So I did my residency in internal medicine at UCLA Olive View Medical Center in LA, and it was a very interesting experience in that we served primarily the indigent population, folks who were under resourced. We got to learn a lot about how to practice medicine when individuals are coming from under resourced countries where they don't or they have limited resources here in the US. And so we got to see a lot of great pathology as a result, which is unfortunate for the patients, but great learning for us.
Right. It's great for doctors, especially in training, but it's unfortunate for patients. What countries,
Exactly.
like what were the predominant countries that the people who had arrived at your hospital were from?
Oh, it was immigrants from all over. I mean, Armenians, Persians, people south of the border, Central America, South America, and even Mexico, and even folks from here in the U.S. Right? Folks who had limited resources here in the U.S. So it was. I'll say it again. It was a great place to train.
Yeah. Well, and I'm sure that's kind of informed some of your future decisions throughout your career. And you ended up in Portland. Like you said, you worked at a federally qualified health center, and you've kind of moved into an administrative role. I guess I'm kind of curious because as we go back to medical school and training, how did you end up choosing that? Because it's a little bit of those are challenging environments to work because you're working with a lot of the same population that, like you say, underinsured, under-resourced folks may not have a big fund of knowledge, may not have had access to education. So what made you choose to do that? You had a lot of opportunities, so I'm curious how you
Yeah,
ended up choosing that.
yeah, that's a great question, Peter. I actually did. I was a hospitalist for Kaiser Northwest Permanente, in Portland for about 5.5, 6 years, and then I switched to another organization called Legacy Health, which is now being bought out by Oregon Health Sciences University. But the time it was, and it's still independent. They haven't merged. They haven't merged just yet. So I switched from Kaiser to Legacy, and at Legacy I was a hospitalist, and was also fortunate enough um, to do ER medicine. So we did, as hospitalists, we did 24-hour shifts, and so my full time was 6 days a month. That was full time, but it was six 24-hour shifts, and
Wow.
then so I had a lot of free time. And my free time, I decided to dabble in ER medicine in a critical access hospital in Silverton. And so I did that for about, I think, 18 months, 2 years or something like that. Um, so in the process, I learned a lot about what ER doctors typically see and how, and of course, seeing the same patients in the hospital. I got somewhat frustrated with the idea that a lot of the things that you see in the ER, a lot of the things that were taken care of in the hospital could have been better taken care of if patients had access to care or had really good primary care in the outpatient setting. So I decided to go further. I naively thought I could make a big impact by going further upstream and taking care of folks as a primary care doctor. So I switched to a federally qualified health center, the Multnomah County Health Department, and I worked in their highest need clinic where they had a lot of immigrants. There are 90 languages spoken
Holy
in
cow.
that tiny zip code that I was in. And then the pandemic happened, and when the pandemic happened, a lot of things changed, and um, I was fortunate enough to join the COVID response and recovery unit in Oregon. This is the arm of the Oregon Health Authority that was tasked with managing the pandemic. I was a senior health advisor with the COVID response and recovery unit. So, team of doctors who wrote the guidance for managing the pandemic for the state of Oregon, and did that for about I want to say maybe 18 months. COVID years seem so far away, and everything seems like it happened a long, long time ago. And at the same time, it was just not too
Oh,
long ago,
right. It was
3 years ago.
actually kind of a compressed timeline when you think about it, but a lot happened.
Yes, 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 yes. So with that, I was fortunate enough to be able to work in communities where we're seeing the greatest need. I talked about the zip code where this clinic was, the Multnomah County Clinic where I worked, 97236. It had the highest COVID rates in the state. It had the highest mortality rate, morbidity and mortality rate, if you age adjusted your data. And a lot of it had to do with, like I said, 90 languages spoken. How do you reach people in a language that they can understand what you're talking about? Long story short, I ended up doing a lot of community work, did about, I don't know, a little over, I did over 100 hours of community engagement events where I went out and talked to people in their masks, in their mosques, in their houses of worship, in their churches, trying to educate them about COVID-19, trying to educate them about the vaccines, trying to convince them to get vaccinated. So much so that we ended up having very, very, very high vaccination rates because of some of the efforts that we're able to put in place and educate people, meeting people where they are and answering their questions. And it was at that time that Cascadia, which is the company that I work for now, Cascadia is the largest comprehensive community mental health provider in the state of Oregon, venturing out into primary care. They asked me to come and be their chief medical officer, and I accepted the offer back in September of 2021, and that's what I've been doing ever since.
Oh,
So,
that's
a
neat.
long story of I gave you a more detailed history of how I ended up where I am.
Well, I think it's fascinating because you think back to medical school and then residency, and then you had this idea, which I just kind of want to kind of hit on that point. You observed working in primary care and then in the emergency care. You observed that there's this huge need for prevention and disease understanding and maybe just some of the behavior changes or screening things that need to happen a little bit earlier. And so you mentioned that you went to federally health qualified health center and somewhat naively hoped that you could change it. I was wondering if did you feel like you did make some differences during that time?
I say naively because the system is very big. I
Huge.
mean, in the US, we spend $5 trillion on healthcare alone every single year. So there's a lot of money that goes into this, and a tiny fraction is spent in federally qualified health centers. Um, and it's incredibly complex, right? If you think of all the players that are involved in healthcare, it's very, very complex. I thought I could prevent people from going to the hospital. I thought I could change the system in a way that people didn't end up wouldn't end up needing to be in the ER or to be in the hospital. Um, but what I realized was that there were a lot of things that happen outside of the doctor-patient relationship, outside of that room that you're with a patient, that affect and affect whether or not someone ends up in the ER. Uh, so now we call them social determinants of health, the social drivers of health, um, that are actually just as important, if not more important, than what happens in the doctor-patient relationship in the physician room where you're taking care of patients. So I changed things for individuals that I took care of, the one-on-one relationships, the management of their chronic issues. But on a grand scheme of things, no, I did not make the changes that I thought were necessary. And it was a humbling experience, to be honest, and I learned a lot from it.
Yeah, well, I think all of us set out to make a difference in the world. The name of this podcast is Doctors Making a Difference. And
Yes,
and you
yes,
know, that's really kind of the gist of it is I think as you talk to people about their individual stories, most people started off medical school kind of bright-eyed and wishing to change the world, and yet the people we really change are our individual patients. It can't system changes, socioeconomic changes are so multifactorial. It's hard for
yes.
us to change it just based on a clinical. But sometimes you do make a huge difference for that one individual, and or you find something that would have gone on to shorten their life, or something that was going to destroy their ability to raise their children, and it makes all the difference for that person. It sounds like you've had a lot of those experiences.
Oh man, Peter, you hit the nail on the head. I can't tell you how many, I have hundreds of thank you notes from patients and their families. And so it shows you the impact that you have to those individual patients. And it's quite humbling to be to be in that situation, right? To realize that your work is improving the lives of others, or even if they end up dying, that they died with dignity, that they were recognized, they were seen, they were taken care of in a manner that respected their individuality, that respected who they were. So you hit the nail on the head. So thank you for highlighting that.
Oh yeah, because as we go through this, do you have any stories or anything you like? Any specific? You can't share HIPAA stuff, but I wondered if you had any stories of any patient interactions where you would say, "Hey, that one time that made a big difference in somebody," or some kind of any remarkable experience you want to share with our audience.
I have quite a few stories that come to mind. There's one that really that touches me to no end. Even to this day, when I think about it, I almost tear up. It was I think she was in her mid 50s, had a lady who had breast cancer, and it had progressed, and it was terminal, and she wanted to see the sunset one last time.
Hmm.
But not just that, she wanted to enjoy a glass of wine as the sun is setting.
Mm-hmm.
And her family kept on saying, you need to keep on fighting. You need to. And I kept on, I was just there as a mediator, just helping them understand the disease process. Um, when I realized that she was close to the end and we still had not carried out her wishes, the hospital had a policy of no alcohol in the building. Um, I I drove down to Costco. This is maybe 10 years ago. I drove down to Costco,
Mm-hmm.
got a bottle of wine, got plastic cups, uh, took it to the hospital. Had a roof that was open, and I took everything up there, and then put her in a wheelchair. Asked her family to come along, and she was surprised. She was shocked that uh, uh, I had gone the extra mile and violated hospital policy as well. And I would not encourage anyone to do that, right?
No, of course not.
But
But what a unique
but
circumstance.
yeah, and she got up there, and as the sun was setting, my shift was over. But I just sat there with her and poured the glass of wine for her, and she wept. I mean, but it was tears of joy. It was tears of gratitude, and it was so beautiful. And she passed that night.
Mm.
And her husband wrote me a thank you note, just saying, you know, we were not ready. We didn't know how close she was, but what you did in essentially violating hospital policy and doing this, bringing her to the rooftop and opening a glass, pouring a glass of wine for her, that really made her feel at peace. That allowed her to say that she was ready. She was ready to go. There it was a Catholic family. They sent me a whole bunch of. They sent me a rosary, and they sent me these what are they called? Prayers, novenas, saying, "Hey, we'll pray this for you every year whenever the anniversary of the death of this lady." It's beautiful to meet people where they are and respect their personhood, as you treat them.
Wow, that is such a cool experience. And, kind of like you said, it's easy to say, like, well, I'm just one cog in the wheel. I can't really make a difference. Somebody's got a policy. I don't want to get my hand slapped for doing something that's not quite within the lines. But, we shouldn't violate policies. They're usually there for reasons. However,
Yes,
I've found, just like you have, the best thing I can do as a physician is take care of the patient that's in front of me. And
yes, very true, very true.
you've
Yeah,
probably found the same thing. Like I've sometimes gone on and I've felt, you take care of somebody for a while, and then you don't see them, and or maybe they switch to another doctor, and you're like, oh well, maybe I did a bad job. But I found that most of the time people are really appreciative of the time you have taken with them and gone above and beyond to say, hey, this person needed this, and for whatever circumstances, I was there in their life at that moment, at that place where they needed me, and I was there, and sometimes I feel like I receive more than I give, as I talk to
oh,
people. I would say very often that's the case.
that is so true, Peter. It takes me back to I don't know if you remember this, social medicine, fourth year medical school,
Uh-huh.
when we had that class in social medicine, and where we were
Yeah.
talking about I still remember it like it was yesterday, where they said all you can do is take care of the individual in front of you, and that's all you can do. And respect the and honor the fact that you have this obligation, and you have to meet people where they are, and take care of them the best way you can, uh, the way you would want your family member to be taken care of.
Yeah, no, and I think it's good for all of us to reflect on this very topic. Like, why did I choose medicine? Why am I in this place? Because it's easy to get lost in I've got to keep up with the medical record system, or I want to make sure I get my charts turned in on time, or I want to make sure I get this many RVUs, or whatever the day by day things are. And yet, it's good to remember patients have placed their complete trust in you as a physician, and you have to meet them in that place where they're at. And sometimes you can affect great change, sometimes just little change. But
Yeah.
one of the questions related to that I wanted to ask you, because is think back to your childhood, and walk us through a little bit how you chose medicine in the first place, and how you ended up as a student at the University of Utah with me all those years ago.
Yeah. So, thank you for that question. I was born and raised in Zimbabwe, and I think I was about 12 or 13. I read a biography of Christian Bernard. Christian Bernard is the gentleman who performed the first successful heart transplant in the world.
Hmm.
And this was at Groote Schuur Hospital in Cape Town. It's the university hospital for the University of Cape Town. on December 3rd, 1967. And as a 12, 13-year-old, it was mind-boggling to think that they could take a heart from one person who was brain dead and put it in somebody else uh, who needed a new heart and have that heart work in that individual. To me, it was mind-boggling. I thought, whoa, what? Showing my Zimbabweanness, I was like, what witchcraft is this?
Love it.
Yeah, but so that got me thinking about medicine, and I thought to myself, if I could have the opportunity to make such an impact in other people's lives, I would always take up that opportunity. So fast forward to post high school, I came to the U.S. for college. And then as an international student, after I graduated from undergrad, I came to the University of Utah for graduate school. Uh, 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 I was in a PhD program in the molecular biology program, and with an interest in genetics. But prior to enrolling, I got to actually, no, I don't remember. It's been way too long, 25 years or so. Anyway, I got into a car accident during that time period, a near fatal car accident that ended up with about 18 or so months in and out of the hospital,
I didn't know that, Bukhosi.
recuperating.
That's a long story. Wow.
Yeah, yeah. So lots of surgeries. I still have titanium rods in my femurs to this day, and knees that were bionic knees uh, from the surgeries. And so it while I was recuperating, I had a lot of time to think about life, to think about what was important to me, to think about the things that were calling to me. There's an old Hasidic saying that goes, "Observe the way your heart draws you, then choose that way with all your strength." I'll say it again. Observe the way your heart draws you, then choose that way with all your strength. And it was in observing the what I thought I was being called to do, what I thought I was being inspired to do, and in making that observation, I felt medicine was my calling, and so I had taken the MCAT already, so I applied to school. I applied to the University of Utah School of Medicine, and since I had already started the PhD portion, the thought was to do MD PhD, and so. What I'll say is that I was fortunate to get into the University of Utah. I got into other schools as well, but the University of Utah was where I wanted to be because of the possibility of doing MD PhD. I was also fortunate in that the Jack Kent Cook Foundation had a scholarship for high achieving students, and I applied for the Jack Kent Cook scholarship, so I became a Jack Kent Cook scholar, and they gave me, I believe it was 300,000 towards my medical schooling. So I went to medical school on this scholarship.
Oh, that is so
So
cool. That is, we'll come back to that later. That is such a neat thing.
yeah, yeah, yeah. So I going into medical school, I knew that uh, if I was going to be true to myself and if I was going to be true to my promise um, uh, to serve others, because that's what I felt my mission was, having been given the second lease on life um, after my accident. I was going to choose. I was going to find whatever it is that spoke to me, and not have to worry about the financial constraints that came with it. And I didn't have to, thankfully, because of the Jack Kent Cook Foundation.
Well, that makes a huge difference. For sure, I want to come back and talk a little bit more about the financial implications of that. But as it pertains to your decision to choose medicine and to make that difference, and a lot of people, I think, can kind of relate with the idea that medicine feels like a calling, or
Yes,
that's where you're led, or that that heaven is pointing you in that direction. And
yeah,
it's so helpful to think about that. When you get bogged down into the days of burnout and challenge, it's a good thing to step back and say, hey, this is why I'm doing this. and
Yes,
I don't
yes.
want to be burdened by the day to day drudgery part of it so much that I forget the main purpose. And Bukhosi, I shared with you some of my story, and I'll just relate with you. I had that. I've shared with listeners on this program. I had a 26 centimeter tumor a couple of years ago, and I had to go through radiation and surgery, and I'm so thankful that I'm here today, and I feel the same way. I feel it's a second lease on life, and I'm so thankful that the doctors that saved my life, and I just think,
Yeah,
wow, this is a rare crowd to be a part of. To finish that up and say, I now get to go back and work as a physician. The same group of people that saved my life, I get to participate in that, and it's a true honor. I have
it
no other.
is.
I have no other way to really describe it. It's a gift. It's an honor, and I'm so thankful to be a part of that group.
Yeah, yeah. I I too am grateful, and I think I wrote about that in my application to medical school about the people that went out of their way to make sure that I was well taken care of. The numerous surgeons and the numerous internists and family medicine docs and physiatrists with whom I worked, neurologists with whom I worked to make sure that I became a better version of myself. So I too am grateful, and I'm very grateful to the doctors that took care of you, because otherwise we wouldn't be here talking, right? We
Right.
wouldn't be,
Yeah,
yeah.
our
So
lives would be different. You wouldn't be raising your kids, nor would I. I mean, there's the
yeah,
and
yeah.
I think about that, having spent some time as a patient and a lot of time as a doctor. It's more fun to be a doctor for sure.
Yes, 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 yes.
That being said, I think about how individually meaningful those experiences are to me and to my
Mhm,
family. And
mhm.
we speak about the doctors that diagnosed and saved my life with great honor and respect and reverence. Like what you shared with that lady who you took care of on the night before her death. Her family will honor you for the rest of their mortal lives.
Yes,
To
yes,
under
yeah.
for what you did for that. And I think about how I feel about the doctors who cared for me. Dr. Scaife was our
Courtney
surgery.
Scaife.
Yeah, Courtney Scaife was our surgery clerkship director, and maybe she'll be upset that I have mentioned that, but she was the surgeon that took care
Yeah,
of me, and having gone from clerkship director all those years ago, and now to doing surgery on a one-time student.
I'm a
That's
student. Yeah.
yeah, and that really was really powerful for me, and I'm very thankful to her and to others who went out of their way. So, well,
So
because oh, go
I'll
ahead,
tell you a quick
yeah, yeah.
I'll tell you a quick story. I did third year surgery clerkship with her,
Oh,
and got
she's
to
a neat
know her
lady.
very well. She's a phenomenal human being, very compassionate, very caring,
Amazing.
and she puts her patients first. So she probably has no memory of who I am, no, but she made an impact on me in that I saw how she cared for her patients, and how she poured herself in with every patient that she took care of. You were the most important thing in that very moment that she was with you. So a shout out and nod to Courtney Scaife.
Yeah, yeah, both of us have a great honor for her. And it's maybe a good reminder for listeners, because there are a lot of people, a lot of us who participate in medical education of students, residents, other learners along the path, and you don't know what impact you have. But you and I can reflect on a person who had a large impact on our lives, and I hope that we can impart some of those same impacts on other learners that spend time with us, because those experiences are they're not insignificant. They make a big difference for not only patients we're caring for, but those. If you demonstrate compassion and that type of leadership, I think it really does ripple out, because other students see how that is done correctly, and it makes a difference in future generations of doctors.
Yeah, she's truly a gold standard. I'll share a real quick story. Um, um, I ended up going to business school at University of Pennsylvania, Wharton, and got my MBA there. One of my classmates had pancreatic cancer prior to coming to business school, and he lives in Idaho. He's a kidney doctor in Idaho, and he told me about how he had this phenomenal doctor at the University of Utah who who resected pancreatic tumor, and he's become very good friends with her. They go hiking, they do these difficult mountain peaks all over the world together. Um, and her name is Courtney Scaife.
Oh,
And
of
I
course.
just, it
Of
brought a
course it
big
is.
smile to my face. I was like, I know Courtney. She probably has no idea who I am, but I know her. She was my clerkship attending when I was a medical student at the University of Utah. So
Oh, that's neat. I want to talk a little bit about how, as we've kind of talked about how you got into medicine and this amazing story of your life. Think about now, we're years into the career, kind of mid-career, both you and I are. And how do you deal with the burnout? Because I think it's real. I would dare say that every physician, after 10 or 15 years in practice, will have gone through a time where they feel discouraged, overwhelmed, feel like they don't make much of a difference anymore, or they find the work becomes repetitive, or they're so tired, so very tired that you can't really seem to pick up one foot and go any farther. And there's a lot of rah 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 from non-physician leaders, but I don't feel like it helps that much. I found for myself the best things are to reflect on what difference I'm making for patients, and then also to take enough personal time to actually take care of myself and my family and pursue non-medical parts of my life. But I'm curious what you've found, Bukhosi. You've obviously done a lot of different things. What are some tips and tricks and wisdom you might share with listeners?
so what I would say is it's very important to take care of yourself in whatever you do. It's very, very important to take time to do the things that you enjoy doing. Whether it's meditating, which I enjoy doing, whether I enjoy reading, I enjoy spending time with my wife, going on walks, visiting other people, sharing ideas, spending time with the kids. I enjoy to this day still exercise three, four, actually more like 4 or 5 times a week. Um, um, I I keep it well, not recently because I was in business school, but I used to keep a journal of my reflections, and then just a reminder that ultimately you're not doing this for yourself. Yeah, so it's important to remember that um, we are in medicine to take care of others. And when we do that, when you remind yourself why you're doing it, why you went into medicine to begin with, I think that grounds you, that gives you an opportunity to, at least for me, it recharges me to realize that it's not about me, it's about taking care of uh, your patients. It's about giving good care to your patients. Um, and that for me is what's rewarding, and that's what keeps me motivated to keep going, even when there's administrative burden, there's burnout, I feel tired. It's whenever I engage patients, I am recharged. It's like I think of Popeye the Sailor Man and how he eats spinach and he
That's
keeps
your
going.
spinach.
My spinach,
Love it.
engaging with the other person. In Debele, we say, I'm Debele speaking. In Debele, we say, Salibo Nani, which is I see you, I honor you, I acknowledge you. And it is in seeing the whites of the other person's eyes and engaging the other person truly in who they are that 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 we become refreshed, that we become empowered. So that for me, that's my spinach. As
That's awesome. I love that. We should bottle that idea up. So I just want to restate that. So as we talk about burnout and how to counteract it, we've talked about all these ideas of patient care and reflect on why we're doing what we're doing, and taking time for yourself. And that's the spinach for Popeye. I like it.
Yeah,
If you
that's a
need some
spinach for
spinach
Papa.
to rekindle and renew, take
Yeah,
some time to get some spinach in your life. I like it.
yeah. So if I could also add that it's in what I've done personally is also do different things, right? I started off as a hospitalist for about 10 years. In doing hospitalist as well, I also did ER medicine for a year and a half, 2 years, and also did switch to outpatient medicine as a primary care provider. And now I'm switching to have 3 years ago switched to hospital administration. I still see patients 1 day a week, but I'm primarily an administrator of a healthcare system. So doing different things, continually challenging oneself. And all these opportunities came about not because if you had asked me when in 2004, when we were at a white coat ceremony, if I would end up where I am today, I would have said, definitely not. I always want to do this. But I've continually challenged myself, continually asked myself what needs to be done and responded to that need and responded to what needed to be done.
Well, and what a, you know, that ability to change and modify your career a little bit, I think is something that maybe gets lost, especially in early career. People will say, I'm in debt, I'm in my 30s, I have a family, or I have all these responsibilities. I can never leave. I can never do anything else. I feel trapped. But the story you're sharing is you can change. You can move to a different career. You can take a different path.
Yes.
You can go back to business school. You can decide to go to outpatient or inpatient or emergency room or administration. And that ability to have flexibility, I think, is a great. It's something that I think people don't talk about very much. They say, well, I'm whatever because I did this residency and I'm locked in it till I'm 65 and I could never change. And that mindset is both short-sighted and burnout inducing. So I love that you had an opportunity that you took to go back to medical or to business school and augment your skills, and then you can share your medical knowledge as it relates to running the business side of medicine as well, and still continue your clinical practice.
Yes, 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 yes. And I think now having the language to speak, the language of those that run the system, right? The finance people. I can now understand why they make certain decisions, and I can now speak to them in terms of, hey, when you make this decision, here's how it impacts patients. When we choose to do this, when we choose to invest in this over that, here's how it impacts patient outcomes. And so having that business degree allows me to do that, especially as a clinician, right? I can see I can see where the decisions that are made in the executive team, how they play out to individual patients, and I can go back and forth, from one end to the other.
That's awesome. It's a really great skill set. I think most physicians who are led by other physicians find that the patient outcomes improve, their satisfaction improves, and hospital systems are just better run when people have clinical backgrounds, especially physicians. And so I think that is a really great thing you've been able to do that.
So you're actually right, Peter. There's plenty of literature now supporting this idea that healthcare delivery systems that are physician run outperform healthcare delivery systems that are not physician run. And when I'm talking about outperforming, I'm talking about patient outcomes, I'm talking about the revenue that they generate, and I'm talking about long-term sustainability. So there's plenty of literature to support what you're saying.
Yeah. This is an interesting statistic or a number I came across a while ago that in the United States, there's only a little over 1 million licensed practicing physicians in the United States. It's really not that many relative to the population of the country and the expenditure of healthcare dollars for the system. And so being a physician in a leadership position is kind of a rare of the rare. And I think there's also opportunities for all of us to exhibit a little bit of leadership, both in our clinical setting and in our hospital and even in the community. Like, there's just really not that many physicians relative to the population of the country. And so having taken that opportunity gives you a voice. Like you said, you can speak the language of those who are traditionally the financial decision makers, and it makes a big difference for outpatient outcomes. That's really cool that you've been able to have that opportunity, Bukhosi.
Yeah, yeah, thank you. I like how you reframe that because I didn't say financial decision makers, but that's what I meant. And you reframed it in those terms because, yes, not all decisions are financial decisions. And you said it perfectly. So yes, they are financial decision makers, and they have to be satisfied, because without money, without revenue, there's no mission.
Yeah. Well, one of the things I wanted to ask you about is a little bit more about finance. You know, you have a business degree, you have a medical degree, you were the beneficiary of a wonderful scholarship. And I would say that for physicians who feel trapped, one of the ways to escape or to find your way out of the burnout cycle is to be financially free, or to say I'm making decisions based on my career, not based on desperation and financial indebtedness, or but rather I'm making this decision because this is what I want to do, or this is how I feel like I can make the biggest difference. And you've been able to have that. Do you mind giving us any more insights on that, Bukhosi? Because I think that really opens so many doors when people live frugally or seek scholarship opportunities so that they can be a little bit more free.
Yeah. So I'll start off by saying that there are more scholarships than there are people applying to those scholarships. So just because you're going to medical school doesn't mean that you should take out large student loans. I encourage people to, I've mentored a lot of, I'd say 100 plus over the last 10, 15 years, 100 plus students who are applying to medical school, who I'd say all of them ended up matriculating to medical school. Um, what I will say is that it is very important to remember that there are scholarships out there, and you do not have to take out loans. That shouldn't be your default. Your default should be, let me search for scholarships. Let me see if there are grants out there available to support students. So and then if you are taking out loans, just live within your means, right? There's no need to be flamboyant. Yes, you're going to make a lot of money as a physician, but in the grand scheme of things, it's important to live within your means. Um, then, lastly, I want to go back to uh, um, this idea that you have to stick to whatever it is that you're doing because of the loans that you have, or because of the financial obligations that you have, either to your creditors or to your family or to whoever. It's important that you always have a choice. You can choose to say, I've seen people who work in under-resourced areas where they don't get paid as much as the average provider. Folks who are working in FQHCs typically do not make anywhere close to folks working for big systems like Kaiser or Legacy. I'm using those as examples because that's what's available in my here in Portland. So you always have a choice to to the decisions that you make. I think that there's a saying by that Gandhi. I think Gandhi said this. Our greatness as humans lies not so much in being able to remake the world, as in being able to remake ourselves. So take that opportunity. Take that. Remind yourself of what's important to you, and respond to to that calling. I am not saying that you should go and work for an FQHC. I'm not saying that you should take a lower paying job. No, I'm simply saying that it's more, at least for me, it's more important to for I feel more fulfilled. I feel happy as an individual when I don't have to think so much about the money.
Yeah. One thing I've observed also as I've talked to people is that there are a tremendous number of, like you say, scholarships, but also loan repayment programs, underserved areas. And like I've worked since residency in a critical access hospital, and I was able to be a National Health Service scholar, like a
Yes,
scholarship, not a scholarship, but I was able to come
a
back and
recipient. Yes.
yeah, I received loan repayment. And so all the loans were paid back through that program. We're all working in an area that was close to where I grew up. And as I talk to people, there are so many loans like that. Most states have loan repayment programs for people that are willing to work at least for a time of their lives in a place where there are resources where they're needed. And there's also opportunities to moonlight, like you talked about, And whatever it may be, if you find opportunities to do public service loan repayment or National Health Service Corps or a scholarship, those opportunities enable you down the road to have greater flexibility for your career. Nobody likes
That
to feel
is
like they're controlled.
Yeah, that is, Peter, that is very, very true. When you say that all these programs that are available at the state level and at the federal level that help people who want to work in underserved areas, under-resourced areas, you also brought up something really neat, which is being of service to others, public service. We talked a little bit earlier about how to avoid burnout. Um, that I find is probably the best way to avoid burnout, right? To circle back to, hey, I'm helping other people, I'm being of service to others, the public service of which you speak. In this case, we're talking about financial independence, right? And
Yes.
how you can get financial independence by working in underserved areas, and also, by the way, it's recharging.
Oh yeah. Well, and because I don't work for a federally qualified health system, but I have found where I practice that most primary care physicians who work in rural areas, they're quite busy because you're taking care of uh, a large scope of patient care from emergency room, inpatient, outpatient, nursing home. That the income is usually higher than people who work in suburban areas, and so people can get ahead financially. But the main thing, I guess the point I want to make is that as you get to your 40s, you want to achieve financial independence.
Independence.
And you
Yeah.
won't get there if you say, okay, I'm 30 or 32 years old and now I'm a doctor and I'm going to go buy $1 million house and a boat and a camper and we're going to have $20,000 worth of vacation every year. You won't get there. But if you live a little frugally in those first 7 or 8 years, try to live on, maybe half or 60% of what you bring home and put the rest toward things that are long-term savings tools. It really does produce it puts you on the path toward financial independence. So that later when you say, I want to go get a business degree, or I want to become an administrator, or I want to start my own business, or whatever it may be, or I want to work reduced hours, instead of finding yourself financially dependent, you find yourself independent, and then you make decisions.
Independent.
That the financial factor is the minority of the reason why you make these decisions, rather than the majority of of the reason.
That is very true, Peter. You said it beautifully. Start saving as soon as you can.
Yeah,
And it's simple principles of economics, right? If you the earlier you serve, that interest will compound, and it'll make the world of a difference as you get older.
yeah.
So
It
start
usually doubles.
saving as fast.
If
Yeah,
you just do a simple S&P index fund, on average, the U.S. Based index funds, your whatever you put in will double after about 7 years, depending on
yeah.
the interest rates. But that's why if somebody was careful with their finances in those first few years after residency, it just sets you on this different path, and it's great.
So save as much as
Save.
possible. Yeah,
And the other one,
live within your means.
oh
Yeah,
yeah, the other one that you've probably thought about, having gone through a life-threatening experience like I have, is have a little bit of disability and life insurance. Because and I found when I found that crazy tumor and had that diagnosis, that was one of my first thoughts, is I'm so glad that I have a disability insurance. Because what if I go through this and I'm so disabled I could never work again, or I could never work a full-time job again? You have no idea, because our
yeah.
lives are pretty fragile, and it doesn't take very much to go from being able to not work and sustain your family in the same way. And
Yeah.
you don't want that to be the thing that rules your mind at those moments. You want to say, well, financially I'll be okay, but I'm making these decisions so that I can go take care of the people I love and live the life that I want to live.
The for me, how I got to life insurance was unfortunately my brother passed away in January of 2004,
Oh, I'm sorry. Wow.
and it was a shock. I mean, he was in his 20s. He was my older brother. He was in his 20s, and um, it hit me that we are mortals. We are mere mortals, and there will come a time when I will pass from this earth. And um, it got me thinking that I need to make sure that there is, if I were to pass, there is some sort of remuneration that can come to my loved ones that will take care of them when I'm gone. And I bought my first life insurance policy in my 20s after my brother passed away in 2004. Um, and I've had life insurance policy ever since. And with that, I was with a company that didn't just do life insurance policy; they also did uh, um, investment advice, wealth management. And so, the guy that I worked with always encouraged me to just put a little money aside, whatever you can, whether it's $100, put it aside so that, like you were saying, it compounds and it doubles every 6, 7 years, and so it adds up. What you put away in your 20s, by the time you're in your 40s, has grown significantly. So
Yeah, it makes
invest as
such a
soon as possible.
makes such a difference. Like these principles are simple, and yet I find so many people don't abide by them. Put some
Yeah,
money aside, have life insurance, get some physician own occupation disability insurance, do what you need to do to take care of your financial house so that when you inevitably experience some burnout in your 40s and you need to make a career change of some type, you're not financially stuck. You say,
yeah,
I can do these things because I love my patients. I've found this true meaning in serving the people who entrust me with their care, and it allows me to become the best version of who I need to be and still take care of my family or go do some of those things that I find the most fulfilling in my life. But
yeah, yeah.
well, Bukosi, I just have loved this interview. It's been so fun to feel your energy and your excitement. I can tell you still have a passion for what you do, and it's awesome. I love that you shared the, what kind of witchcraft is this? And so I hope that we can keep doing positive things for our patients and keep making a difference like you've been doing for all these years.
Yeah, Peter, it's so good to reconnect with you. You are always a very kind and conscientious human being. I am honored to be part of your journey. I'm honored that we reconnected, and thank you very much for having me on this show.
Thank you, Bukosi. I hope we get to talk again soon.
Take care, my friend.
Thanks.